Hi everyone, this is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic, and I'm here today with Phyllis, who is my mother. She's in here to get a little bit of relief for her low back, and it's going into her right hip as well, on like the side area.
Mm-hmm. Yep, this part.
Okay, and your pain level today is a 5 out of 10, is that
5.
correct?
Yes.
Okay. Anything else going on, or is that everything?
I have a little bit of a headache.
A headache too?
Yes.
Okay. What would you rate that pain level at, 0 to 10?
Probably 3.
A 3? No neck pain, just headache?
Oh, a little stiffness. I think maybe I didn't sleep too well.
Okay, gotcha. All right, so let's go ahead and lay on your stomach. We'll get started.
Should I take my shoes off?
You don't have to, but if you want to, you can.
Okay.
So I've worked on my mom before, obviously, and I'm pretty familiar with what she has going on. And usually she's got tight glutes, which she has today. And so, just like with other patients that you've seen me work on, I'm going to ask her if this pressure's okay, if it's not too much.
Yeah.
It's
pressure.
all right.
Yeah,
Pressure's good. So we're just going to loosen this up. This is muscle work for her glute. And when your glute is tight, it can cause a lot of back pain because these muscles attach in your pelvis. And when they attach to your pelvis and they're too tight, they'll kind of yank on your low back and give you that low back tension. The other reason these muscles are really important to work on is because these muscles lay on top of your sciatic nerve. When the muscles are tight, yeah, you can go wherever you need to. When your muscles are tight, they put that pressure on the sciatic nerve, and that's where you get that sciatica symptom, which is that like painful numbness or tingling down the back of the leg, and can even go all the way down to the foot. And it's been a little while since I worked on her, so she's pretty tight. Almost done. Good. We'll check the thigh, not too bad. Just a little bit of work here. Pressure still all right?
Mm-hmm.
Good. So I'm just going to check her low back, see how it's moving. The right side, when I push on it, is a little more stiff than the left. And then I'm going to go up her lumbar spine here and feel how it's a little bit tight in this area. So we're going to work on that, get that adjusted in a different position than what she's in. So I'm just going to scan first before I adjust. And then now we're going to scan while adjusting the mid-back. So go ahead and breathe in and breathe all the way out. Good. Good. And we're going to breathe in and out here. Breathe in deep and all the way out. Good. Good. Breathe in and out. Good. All the way out. Excellent. And so some people, when you have them breathe in and out, go ahead and breathe in. You can't hear them. Breathe out. But my mom breathes out loudly so I can pay attention to where the right spot is and wait to deliver the adjustment. Go ahead and roll over onto your back. The reason we have people breathe in and out is because when we're putting that pressure in that area, if there's a lot of breath in there, it can kind of knock the wind out of you. So breathing in and out really helps with that, and also just helps get the joints to where they need to be before we deliver the adjustment. Rotate toward me from here. This is where we're going to adjust the low back. Good, and breathe in and out. Good. Excellent. Go flat on your back again. And bend the right knee. And rotate toward me. We're going to just switch the grip a little bit here. Good. You breathe in and out. Good. All the way out. Good. Let it go. There you go. So because it's kind of going into the front and the side here, I'm going to also adjust her hip. Just relax your leg. Good. Lay on your side and face that way. Good. And bend this knee, straighten this one, and bring your knee up to your chest, please.
This one?
Yep, perfect. And straight down again. Good. If the pressure's too much, let me know.
Yeah, a little bit too much.
This is a little bit more of a specific and a more intense move for the muscles and the glutes here and the piriformis, but really helpful in loosening this up. Good. Pressure's good here?
Pressure's good.
All right. Couple more. And last one. Good. Let's go on your back. And we're going to get this one spot that we didn't really release too much in your lower mid back. You just have to breathe in and out for me and do a little bit of a sit up as you exhale. Good. All the way out. Let it go. Excellent. You can relax your arms. So that one move I just did there, sometimes we don't get the release we're looking for in that one first position where she's laying on her stomach. So by doing that other move, you get that release that you needed. And the nice part about chiropractic is there's different techniques for different things. Like if her low back didn't move in that side posture position where she was kind of rolling over onto her side, then there's another technique called drop table that we can use and get the same effect, but a different technique. That way everybody that comes in here gets the care they need in different ways. So what I'm doing here is I'm just checking her motion, her neck. Let me move you over to this side, and we go over this way. So as you can see, she goes this far this way to the right, and over to the left she kind of gets stuck, which is an indication that she needs an adjustment in her top right in her neck to encourage motion into the motion restriction. If you notice here, I'm kind of moving her head towards the direction she's not moving in. And I'm just going to relax that, and there you go. Now we'll check this range of motion here, the lateral flexion in the neck. And what's interesting is it's kind of all on the one side. Usually people present with upper left, lower right, or upper right, lower left. She's all on the right side. Just relax this here. Good. Good. Now when we check the post check, she goes that far and that far. She's now even. Checking other ways of looking for fixations. Just a little bit on the left here on the lower part of her neck, and just let that go. Good. There you go. And just going to loosen up the muscles a little more in the neck. Let's go ahead and sit up. And we're going to face the left wall. Swing your legs around. Good. And take your arm, put it out to the side, and go across your chest. Good. And then grab this elbow with your left hand and pull that in tight. Good. Go back out to the side. And over. Good. Again, we're going to do this multiple times. Just keep moving. So this is loosening up a tight muscle in her shoulder that goes up into her neck. Mm-hmm. By loosening this, it'll help release a lot of the tension to her neck that could be causing this headache that she has.
I can feel it crack.
Good. Keep going. We'll go a little lighter.
Yeah.
2 more. And 1 more. Good. And relax.
Yeah, that's better.
Raise this hand like you're asking a question and put that hand down onto your low back. low back.
Oh.
There you go. Up again and down. That first move we did for your shoulder, that's what my brother really likes. He loves that move.
Yeah.
Good. Keep going. 3 more. And last one. Good. Relax. And that's it.
Okay.
So, how's the low back feeling? 0 to 10 scale. Be honest. Just because I'm your son doesn't mean you have to say it to 0.
I don't have any pain.
Go ahead and stand up. Let's see how
I'd
it feels.
say feel good as new.
Good as new.
Good as new.
Okay. And what about the neck? Headache?
Neck is good.
Any pain at all?
Slight headache, but not as bad as it was.
Okay.
But
How much water did you drink today?
oh, I drank a lot of water. I drank a big liter.
A liter?
Well,
Okay. Drink another liter today.
Okay.
You want to make sure you're drinking half your body weight in ounces of water a day.
Okay.
And then if you're drinking any caffeine, make sure to balance that out the right way.
Right.
Okay?
Got my green tea.
Yep, definitely have to have some green tea is good for you.
Mhm.
Absolutely. So that's it for us.
Good.
I'm your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic.
Thank you.
You're all ready for your shenanigans that you want
I'm
to be
ready
up
for
to?
my shenanigans.
Have some fun, all right? Thanks for watching.